Hello, welcome back to the plenary. So we are now the last session for recap from the panels, about panels and conference sessions. Yes, it's likely. So there are so lively sessions were going, and so I have heard the power of nurses and midwives in the region and beyond. So let's use the final time for the feedback from the sessions, and then so interactions for beautiful sessions. First of all, I would like to ask from the moderators of individual session for very brief feedback, and then for other people can join to add more of the things. So may I invite Dr. Igarashi, the moderator of the Community and Public Health Practices session for the initial brief and the feedbacks. Dr. Igarashi, please.
Okay, yeah, first of all, thank you very much for all the three presenters for sharing the diverse and the important perspective of planetary health, climate change, and the community and public health practices. The first presentation showed how the climate change is increasing disaster risk in Japan and highlighted the role of public health nurses in preparedness, response, and recovery. A key lesson was the community-based public health professionals, term-based practice, and the coordination leadership are essential for resilient and equitable health systems. And then the second presentation examined the weather. A presentation examined the presentation conditions and the sedentary behavior in emerging adults. It explained our understanding by showing that health behavior are not only the individual choices, but are shaped by weather, climate, school, social, and environmental conditions. This also reminds us of the importance of nursing research that can generate evidence directly connected to the health promotion, prevention, and the community-based practices. So, and then the third presentation focused on the heat waves and health from the nurses' perspective. It remained as the climate change is already visible in world, the communities and the patient homes, and that nurses can act through risk assessment from family education, discharge guidance, and connected to the local cooling resources. It also delivered a strong message to the young nurses. The climate change is not the further issues. It is already part of everybody nursing practice. So taken together, these presentations show that planetary health must be translated into daily public health and nursing practice. The climate change affects health through disasters, heat, air quality, daily behavior, and the social vulnerability. The nurses and midwives therefore have roles not only as care providers, but also as educators, risk assessors, coordinators, advocates, leaders, and researchers. Thank you so much.
Thank you so much. And so it's a very informative and full of discussion ongoing. So any additional inputs from the speakers on the session? Any questions? We can continue later. So thank you again. So then next, I'd like to invite Dr. Nakano for the brief and feedback from the hospitals and outpatient practices session.
Thank you, Dr. Nakamura. And in block 3B3, the session on hospital and outpatient practice, we welcomed three speakers from Australia and Japan to discuss effective strategies and initiatives for promoting planetary health in acute care settings. The speakers introduced the current status of planetary health in their own country and the activities they experienced or participated in, such as reduction of material misuse in clinical setting, making hospitals to be centers of resilience and response, and building health professional capability or zero emission activity in manufacturing, and problems of medical waste. And survey for rethinking using materials in clinical setting, and many other contents. In discussion, we changed the opinion about how should nursing professionals specifically engage in this decision-making process about planetary health in the organizations, and how treat the trade-off involved on today's issues. Finally, we are suggesting about one action for tomorrow from each speaker. And I would like to express my gratitude to three speakers and the people to participate, and hope that each of the participants will take today's discussion back to your workplace, where it will lead to further discussion and action. Thank you.
Thank you very much. And I think that there are a lot of things to take back home and to reflect your practices. And yes, thank you so much. And then we had the nursing education and research session. And then may I ask Zerina to give us some feedback from the session?
Thank you. I would be delighted. So we actually heard from Dr. Ikazaki from Japan and from a student, Hee-won Nam from South Korea. And I had the third presentation. Dr. Ikazaki spoke very wonderfully about Japanese efforts in terms of policy and regulations to try and bring the hospitals up to date in terms of sustainability. So we saw quite a lot of initiatives taking place, particularly in terms of plastics and managing those, but also I was very impressed by the disposable diapers initiative, where Dr. Ikazaki described that in adult population, there's an increase of disposable diapers use, and actually how that's a significant environmental pollutant. However, there is a methodology that is actually recycling those and ensuring that they're actually reused for making different kinds of diapers down the track as well. Overall, Dr. Ikazaki also spoke about the need to educate more Japanese nursing workforce to be able to really have these initiatives Japan-wide. I hope I got that right, Dr. Ikazaki. And I was really inspired by Hee-won Nam's presentation. Hee-won is actually a nursing student from South Korea. She only got inspired into planetary health last year after attending ICN conference in Helsinki, and since then has actually undertaken significant initiatives within her student body to promote planetary health, both in terms of lectures and education, but actually bringing student groups together to try and actually broaden this impact across South Korea, which I think is quite remarkable. And I very much look forward to seeing your future. I like to call you Nurse Nam, even though I recognize you're a student. And my own presentation, which feels a bit awkward about reporting since it's my own, very much spoke about the initiative called Maternal and Child Health Climate Adaptation Resilience Network, which actually brings researchers across Asia Pacific together, 5 countries at the moment, Bangladesh, Indonesia, Malaysia, Fiji, and Australia, trying to understand community needs in terms of climate adaptation and resilience, and then working with the community and the governments to co-develop interventions that would indeed protect the health of pregnant women, new mothers, and children under the age of 5. And my presentation very much called upon nurses that to actually engage more with the community, more into co-design, and really to remember that we are here to serve our community and that there's a lot more we can do for those people. So that's, I think, enough from me.
Thank you so much. And so yes, so now any additional thoughts and then inputs and questions and yes, ask actually. So the all the sessions and so tremendous, and then also you have and discuss how to move forward and so take the message and for the next step and so that is so excellent work and so today everyone did for that one. Any specific questions and not specific or any comments? Well, I like to when we start this webinar, regional webinar, so the diversity of the region and diversity of speakers and diversity of topic, it was so challenging. But for all the peoples and cooperation, we had a lot of learning. So for the panel speakers and the Dr. Yukari Nakano, so Dr. Hen Yon Lee, Dr. Edwin Lavia, and then Dr. Megumi Tekishima, and then also the moderators, and so for Anna Akins and Dr. Kumiko Igarashi, Dr. Yukari Nakano, and then also all the speakers, and so Dr. Sumie Ikezaki, the Howin Nam, Zelia Locking Tompkins, and then Dr. Gemma Sarabons, Ayasa Terada, then Helm Sam, and then Yu Sumie. And then I think in the diversity of the yes, generations. It was so amazing. And then a very, very active and strong inputs from the young people. I think it inspired everyone. And then I'd like to take the liberty of the co-chair of the session. I'd like to share with you so the information from my side for how to take the message to today for the next step. Well, it was obvious there was tremendous work and tremendous work and already actions in the region by nurses and midwives. So because nursing and midwives was in front of patients and communities, and then taking care of the management of the hospitals and the communities and the region. And then it was so strong to hear that already a lot of action is taking place. In the planetary health, it is very important we talk about and they do actions, not just to talk, but take actions. And then also then also that such action should be shared with other community and then spread more action globally. It is important. Next year, so there is a conference of Planetary Health annual meeting that will be on taking place in Tokyo. So I hope many nurses and midwives join. But also this conference is not only for nurses and midwives, but also all the different special people in background, environment scientists, engineers, and material scientists, and then economists, and then community development specialists, and then practitioners. All those people join. And then it's very important what you are doing today to discuss together with in the global platform with multi-disciplinary colleagues, and then that will definitely contribute to advance planetary health in the global scale. Well, it's still in the preparatory stage, and this is the joint hosted and Planetary Health Alliance Global Alliance, and then Planetary Health Alliance Japan have and a co-host. We started the planning. So that some details will be coming on the website maybe June. And then this is called for abstracts, and it will start June, and then the September is the deadline. I hope many inputs from the nurses and midwives to this meeting, and we can share your experiences and learning with other communities as well. So thank you very much. So you can register through this QR code to get more continuous information on this conference. So I thank you very much for your joining. And then maybe we will continue our discussion today for next year. And then also I noted there are many local and regional meeting relating planetary health taking place. Please let's continue our communication, and then also to get together larger space on the next year in Tokyo. Thank you very much for joining, and then also appreciate all the audience today. And then I hope so everyone gets the idea of power of nursing and midwife for planetary health. Thank you very much for joining.
Thank you for having us.
Thank you very much.
Hi, everybody. I'm Ray Harwood, and I want to thank you for attending our conference. This has been a really great adventure for you and for us,
Yes.
and we really thank you for being here. We have been a team, and I want to introduce you to the planning team who is, without their help, this would not have been possible. I've taken care of some technical things on the back end. They are the ones that have really brought this content together for you, and I hope you've enjoyed it very much. I envisioned this entire conference starting a year ago, March of 2025, and it's really been great to see it come together with all of their help. And so I'd like to introduce you first to Diva Marie Beck, who has done a really great job. Many of our speakers have been in touch with you, Diva, and I look forward to hearing you.
Oh, thank you so much, Ray. And greetings to all of you. You've had a day of wonderful presentations, learning about planetary health, and sharing your thoughts and participating and listening. And it has been a pleasure to be in support of you, coordinating with you, meeting you. It's been a pleasure from start to finish.
I am Barbie Dawsey, and I'm with DIVA in the Nightingale Initiative for Global Health and in Santa Fe, New Mexico in the United States. And I just want to say right now, you're probably swimming with so many ideas. I sure am. And just want to say, nurture yourself, nurture your noble purpose after hearing all of these. And this is for all of you nurses and midwives. It is just such a joy. And take care of yourself. Really identify what do you want to do? And I also want to say Florence Nightingale called her work her must. So after this conference, what is your must? Heidi.
Oh, thanks, Barbie. Hi, everyone. Again, Heidi Honegger Rogers, also coming in from Santa Fe, New Mexico in the United States. I think what's amazing about putting together this global conference across all of these time zones around this world, especially, on the heels of the Artemis 2 mission, where we've gotten to see new images and to think about how nurses and midwives are coming together from everywhere to show up for each other, for ourselves, for the earth, for our communities. This is such an incredible community of people. This is us coming together potentially this way for the first time, but certainly not for the last time. This is a movement. This is the future of nursing. We are here showing up for that work together. And it's been just an honor and a pleasure to work with all of you, all of the visionaries from around the world on bringing together all these stories and insights and wisdoms. Teddy Potter.
Hi, I'm Teddy Potter, and I come to you from the land of the Dakota and the Anishinaabe people in Minnesota in the United States. And it has been my great pleasure to plan this conference with the people you see on screen here, but more importantly, to see all of our experts from all around the globe coming in to share their knowledge and their expertise and skills with all of you. It gives me great hope to know that nurses and midwives are showing up because, in fact, I believe it is the only time things get done is when nurses and midwives show up. So again, it gives me great courage, great hope to see that we are building a movement. We are building an action. We are building a process to ensure a better future for all the world's children and grandchildren and people. So thank you for being here. This is just the beginning. Please look at our list of sponsors and see how you might be engaged with their work. There's a marvelous group of people who have sponsored this programming, and we want to make sure that you connect with them and learn how to stay part of this work. So thank you for being part of this bold adventure. We need you more than ever. Thank you.
Thank you.